Hi, this is Dr. Michael Corsillis, and I'd like to talk to you about testosterone. This is just a quick, brief rundown on testosterone. Is it for you? What are the benefits? What are the side effects? So I do see a lot of patients when it comes to hormonal balancing. So when it comes to testosterone in particular, I treat a lot of men and women with low testosterone. What are some of the signs and symptoms of low testosterone? Fatigue is usually the most common thing I see. The next common thing is like low sex drive. Another thing I usually see is like low mood, low motivation, down and depressed sorts of feelings. Some people can actually have weight gain as well. And so when it comes to checking out your testosterone levels, what do you do? What are some labs works and what's some tests that you need to do? Testosterone check is it's a blood draw, so no need to fast for this one, but it's a blood draw you do. I typically recommend checking your testosterone levels first thing in the morning, so early in the morning. We try to get your testosterone levels at the optimal levels, which is typically in the morning. So I don't want to check it later in the day. So first time in the morning. Sometimes I'll check it a second time just to confirm a diagnosis of low testosterone. And that's a big range, especially for men. It ranges anywhere from 300 to 1100 or 1000 for your total testosterone. And just because you're on the low end, you might be indicated to have testosterone. Now, there's other testosterone markers I check for the blood work. It's not just total testosterone. Like I need to check free and bioavailable testosterone, other more active forms of testosterone. Total testosterone will also include bound up testosterone that's just has other proteins stuck to it, which inactivates it and really doesn't do a whole lot for you. So I like to look at those markers, and it's good to rule out other labs as well that's contributing to fatigue. Is your thyroid off? Are you just having low iron? Are you anemic? So there's a number of things you want to rule out first before starting testosterone. Then you also want to find out what's causing the low testosterone. Testosterone normally drops in men and women as we age, but I treat a number of folks who are in their late 30s and 40s, for example, with low testosterone. What's causing it to drop? So often what I see, what causes it to drop is actually high stress, super high stress. It's kind of like these first world problems. We're just burned out because we're working all the time, not getting enough sleep, not getting enough exercise, and that actually drops your testosterone. There's other things that'll drop it. Sleep apnea has been shown to drop it. If you're obese, testosterone, if you have a big belly, testosterone can convert into estrogen more often, which we don't want in men. And so weight gain contributes to it, and all the things associated with obesity, like diabetes, heart disease, all of those can lower your testosterone levels. So we have to identify and treat the underlying issue rather than just putting testosterone in the system. We have to try to focus on boosting it naturally too. So then there's a number of treatments as well, which I typically go over with patients. What are the indications? What are the potential side effects? What are the benefits? Two big side effects I get concerned about with testosterone, because not just everyone can do it. It's really individualized treatment. There are testosterone in shot form, cream form, pellet form. There's even some possibly like nasal spray form or nasal gel form. But the most common is just the creams or shots or pellets. Pellets are like you implant those under the skin, which slowly dissolve over time. But the two biggest side effects of testosterone is it can raise your blood pressure. It can thicken up that blood too, which can make you more prone to strokes or heart attacks. So you gotta make sure it's truly indicated for you if you want to go on testosterone replacement. There's also things to focus on to really try to boost it naturally. And that's of course stress reduction, managing stress, making sure you're not obese, so eating healthy, and having a good technique of reducing stress, whether that's meditation, exercise, prayer, etc. So that's always indicated, those ways to boost it naturally, and in addition to if you really need to go on testosterone. So those are some of the basic things about testosterone. When it comes to treatment, I'll go over those few options for you, whether it's straight up testosterone or the precursors or the building blocks to stimulate testosterone production. So hopefully this is just a quick rundown of testosterone. Hopefully that helped out, and I will talk to you guys later.